Have you seen any sequelae of COVID that has resulted in, let's say, increased problems with heart valves and so forth that required intervention?
Great question. I think that we haven't had enough time to truly ascertain the effect on a population level. Anecdotally, like case to case, I think that a lot of the patients who had overwhelming or fulminant infection with a lot of cardiac issues, they were so sick in the acute setting that it was really difficult to see how much of it was due to the acute illness and being in ICU, being on a ventilator, and all the complications of that versus a more intermediate to longer term. I will say that what we're seeing in clinic is the patients who had some degree of underlying cardiovascular disease who then got COVID seem to have a more rapid progression of their either underlying coronary artery disease in terms of symptoms or in terms of I guess, their underlying reserve in response to their disease. So it's not to say that their, for example, valve leak or valve narrowing got worse because of COVID. But rather, what I'm seeing is that those patients and their physical capacity and reserve to manage with those conditions has changed. In that COVID has actually taken away a lot of their reserve. So where before getting COVID, they could manage with that degree of leak or narrowing of an artery or a valve, now they struggle a lot more. Their exercise tolerance is less, their fatigue is greater, they're more symptomatic. I think that's what I'm noticing.